Hello, everyone, and welcome to another episode of the show. With COVID-19 and Omicron surging in many parts of Canada, as well as booster shots being rolled out in the various provinces, the additional announcement today for an additional 140 million rapid tests in Canada. Joining me now to discuss all of this is Katharine Smart, who is the president of the Canadian Medical Association, and Rachel Gilmore, federal politics reporter for Global News. Katharine Smart, I think I'll start out with you, and I'll just ask specifically as it relates to the announcement today with 140 million rapid tests. What is this going to do in terms of how we continue to move forward with battling COVID?
I think we're seeing, with decreased access to PCR testing really happening in all jurisdictions across the country, a lot of Canadians are now having to turn to rapid testing to confirm their symptoms. So I think that was great news today from the federal government that more rapid tests are coming to Canada. I think it's a great tool that can empower people within their homes and families to know what's going on, to feel like they can test, knowing that many people won't have access to publicly available testing. So I think that's going to be very useful for people. I think it's important that Canadians know how to use rapid testing. And I would say, I think the most important message about it, it's a bit like a stoplight, right? So if it's positive, you can safely assume you have COVID and continue to isolate as per the recommendations of public health where you live. But if it's negative, you need to be a bit cautious and make sure that if you're having respiratory symptoms, that you don't assume it's not COVID, and you should probably test at least another 1 or 2 times to be certain, because sometimes the test result can lag a bit behind the symptoms. So I think that's important to know, but I think they're a powerful tool, and I think we're going to see that here over the coming weeks.
And Rachel, I'm just going to ask you how relevant you think this is, because obviously it's good news, but at the same time, many provinces like Ontario have made it harder in many respects to get a test, whether it's a rapid test or a PCR test. So obviously the announcement of these additional rapid tests will help, but at the same time, just speak a little bit about whether or not there's any indication of timing as to when these will actually be shipped to the various provinces.
Yeah, so the federal government, in their announcement today, they said that they are expecting to ship all of these, or a significant chunk of the millions of tests that they just announced today, in the month of January. So that's really good news. The provinces are going to be really happy about that because they have been asking to get these tests ASAP. So the fact that they are going to get them this month is probably going to make a lot of people quite happy. But obviously, there have been a lot of issues with rollout. We've seen that across the board. So it's been a little bit different depending on which province you're in. But if they can get those issues sorted, get those tests into hands, I think a lot of people are going to be pretty happy about it.
And I'll just follow up even on that with you, Rachel, because even we're getting these additional rapid tests, but even if you look in regards to Ontario politics in the Ontario legislature, there seems to be a disagreement as to how many tests Ontario has even received. Like the provincial government says on social media and such that it's around 50 million. And then if you look at Canada.ca, I believe the figure is around 39 million that have been deployed. So even that, it seems as if there's disagreement just kind of around the number of how many they've received. So maybe speak a little bit about if there's any way in your view that some of this hesitation around some of the numbers can be fixed or with this announcement of additional rapid tests.
Yeah, so I think, at the end of the day, what solves a lot of issues when it comes to numbers and things like that is when people have things in their hands. So I think that if these tests arrive and they arrive fast into communities, they're rolled out properly through, a federal and provincial teamwork, which, can sometimes be a little dicey. But if they can do that, then I think a lot of people, whether it be provincial or federal, will be happy because their constituents are happy. And when the constituents are happy, the politicians are often pretty happy too.
And Dr. Smart, on many provinces, Ontario went back to a modified stage 2. Quebec is in a curfew during the evening. Nova Scotia announced additional school closures. So there seems to be a pattern of, the majority of provinces implementing new measures, new restrictions. Do you think that this will actually be able to lower cases for good? Like, do you think that's the hope with these new measures, or is the main hope in your view doing this so that buying additional time basically for people to get booster shots into arms?
Yeah, great question. I think the public health measures that we're seeing are really aimed at trying to blunt this wave and protect capacity in the hospital and healthcare system. We know that obviously this particular variant is so contagious, and the rate of rise of cases has been exponential. And of course, right, we really don't have any idea how many people are infected right now because we haven't been able to get everybody tested. But what we are seeing is increasing pressure starting in our hospital systems that were already quite overwhelmed. And that's combined with a lot of staff who themselves either are infected with COVID or have had high risk exposures, so are having to also be in isolation. So that combination of rising patients, fewer healthcare workers to care for them, of course, leads to hospitals under significant strain. So I think the goal of increasing these public health measures are to try to blunt that exponential rise, to protect the healthcare system, to make sure it's available to Canadians, and of course, also to buy more time to encourage people to get that third booster shot. We know with Omicron, having 3 shots makes a big difference, so that's important. And then I think with the schools, we're seeing governments trying to, get more things in place to make schools safer. That's of course frustrating because we've known what those things are for a long time. So why that hasn't already happened and why we've got kids and young people out of school again is quite frustrating, I think. And certainly for myself as a pediatrician, I really question that decision. So I think, what's going to happen, time will tell. Is it too little, too late? Are we going to see our healthcare system overwhelmed? I don't think we know that yet, but I'm hopeful that between our high vaccination rate, people choosing to be boosted, people following public health requirements, staying home if they're sick at all, limiting those social contacts, that we're going to get through these next few weeks.
And Rachel, when I just asked Katharine her question about booster shots and whether it's basically buying time to get booster shots into arms, is it looking though, as of right now, like provinces are actually going to use this time for that, or is the hope kind of just what the hope's been in the past, that the lockdown will be to basically just alleviate strain on ICU capacity?
Yeah, I mean, so lockdowns are always kind of to serve that purpose, right? Is to just try to slow things down when things are getting a bit crazy. But I do think that as far as numbers, we do know that there's a lot of booster doses in the country, but where we run into a big problem is having enough people to actually put those into arms, right? And that's a big issue because it takes specialization. Like, I couldn't vaccinate someone. I don't know how to do it. But provinces are working to get as many people as they can available to administer those shots. But with Omicron making so many people sick too and forcing them to isolate, that's proving to be a really difficult logistical issue. So, the boosters, getting them into arms, getting that rollout going is incredibly important. But there's so many kind of capacity issues and structural issues that are, so complicated. They date back to all kinds of issues with respect to the healthcare system and funding and capacity and all those things. So, yeah, it's a really complicated question. And I think we're all just hoping that we can get as many boosters into people's arms as possible.
And Katharine, speaking a little bit to the point Rachel made about, not anyone can administer a vaccine, and therefore there's a shortage of people to administer them. Is that what you're finding in your role as president of the Canadian Medical Association?
Well, Wyatt, I think it reflects just the strain on human health resources in the healthcare system that we're seeing across the system. So we've got lots of people working on vaccination, primarily nurses, pharmacists, and physicians that are working both at pharmacies, but also at mass vaccination centers, and some people in their own clinics. So I think we've definitely got all hands on deck. But just like we're seeing issues with healthcare staffing in hospitals, of course, those same healthcare providers that are trying to provide boosters in those settings are also being impacted by this wave. So I think it is really a challenge with the number of people that are available. But I think what you're seeing is a real effort to sort of pivot resources where they're needed, right? So let's make sure they're in our hospitals attending to people who are ill, and in the community trying to get people boosted. So I think there's definitely an all hands on deck approach but it is against a backdrop of a human health resource crisis and people that have been very strained for a long time. And I hope what comes out of this pandemic is a renewed interest in recommitting to adequate funding in the system and making sure that we're looking after the healthcare workers that work in the system, because I think what's been really made clear through this pandemic is there's no healthcare without healthcare professionals.
And Rachel, numerous provincial governments now have implemented measures to move to online learning. Nova Scotia announced today that they'll be going now until January 17th. Ontario is going until the 17th as well. The Alberta Minister of Education gave a press conference today where she announced that that the date to go back on the 10th was still planned, and British Columbia did the same. So it seems as if the pattern, as well as the majority of provincial governments, are deciding that the best option is to push back the return of school by at least a week, some doing 2 weeks, to try and, retain the spread of COVID within school. So 2 questions on that. Number one, how popular of a move is this being taken by residents in various provinces, specifically by even parents and students themselves? And then number two, just speak a little bit about whether or not you think announcements like these will have to happen again in the future, but specifically if they do happen again in the future, what some of the political impacts of these leaders could be having to close schools numerous times now.
Yeah, so to your first question, I think, I know that you see people on Twitter and giving their reactions to these kinds of announcements. And the reaction to the announcement of school closures was pretty intense. A lot of people were really upset by it. And I think that a lot of those complaints appeared to sort of center around the time of when that was communicated, how it was sort of last minute. A lot of people were expecting to go to school, the next day, and it didn't end up happening. So a lot of parents were scrambling. So I think that there has been some criticism levied at, the Ontario government, at least when it comes to how they approached, making that decision and when they made that decision. So obviously this is a time when things are moving really fast, they're changing really fast. So it can be, I'm sure it's tough. I don't envy them. But it's still causing a real ruckus amongst parents who are quite distressed because, how do you plan? Childcare is expensive. There's all kinds of complications with last minute announcements. And could you just remind me what your second question there was? It was on the policy implication?
Just how big of an impact moving forward will governments closing schools again have on them from a political standpoint?
Yeah, I think that closing schools is a really complicated and often unpopular move because schools aren't just venues for education. It also provides childcare when parents are at work. It provides students with the ability to escape homes where they might not have the same kinds of resources that they have in school. So there's a number of community benefits to kids being in school that are, really complicated and really nuanced. So I think that, the more times we see schools locked down, particularly if there aren't lockdowns or shutdowns or restrictions on other facilities that are maybe a bit more recreational, you're going to keep seeing a lot of backlash. It's something that I think, just based on what we saw in the outcry, people seem to think that it should be the last resort.
Okay, and Dr. Smart, I'll ask the last question to you of our panel. So maybe you can speak a little bit about, like in Ontario specifically, and I'll just speak to that, and I know it's the same in many of the other provinces, but there's measures like N95 masks to be provided at no cost for teachers, for students, and again, that's largely the same in many provinces. And then there's people are calling for vaccination clinics to actually be set up in school. So speak a little bit just about how, if those measures were to be taken in the majority of provinces, do you think those measures would actually make it so schools could reopen, or does it really require more than that?
Great question. I think what we've really learned is that when we're dealing with COVID, there's no sort of one solution to all the problems it causes. And there's not kind of one thing that makes spaces safe or unsafe. And I think that's honestly been a challenge in this debate about schools. It's become very polarized, like they're either safe or they're unsafe. The reality is there's a spectrum of what's happening there. And overall, schools actually are very safe. There's really no evidence they've been driving transmission in the pandemic, and there hasn't been any disproportionate outbreaks of COVID in schools for kids. So arguably, they're one of the safer places for people to be. Now, that doesn't mean no one ever gets COVID at a school. Of course, that can happen, but it's really not a major driver of the pandemic. So I think that's important, because I think when we try to make it safe or unsafe, we're sort of missing the nuance of the fact that there's layers to what safe means. And that, I think, comes back to your question, which is what they're talking about enough? So we know COVID is airborne. We know the better quality of mask you wear, and with respirators or N95s, KN95s being at the top of that level, are going to provide better protection. But of course, you also have to be wearing the mask, and it has to be on your face continuously. So if you've got a great mask, but you're only wearing it part of the time, or you're fiddling with it a lot, or you're taking it on and off multiple times a day, you're not going to reap the full benefit of that mask. So again, on its own, it's not the only solution, but I think it makes tons of sense to increase the quality of masks available to teachers and students to try to bring that risk down. Of course, the other piece is ventilation, making schools that are well ventilated. That's going to be helpful. And I think making the vaccine as accessible as possible by providing access within schools makes lots of sense as well. You know, we're seeing some uptake in the 5 to 11 age group, but it's lagging behind what we're seeing, for example, in 12 to 18. So is there a role to improve that by having vaccinations available in schools? I think prioritizing teachers for boosters makes tons of sense as well, because again, with Omicron, we know having that third dose makes it less likely that you're going to get infected. And most importantly, it's going to protect against severe disease and hospitalization, even though we're also seeing that benefit from 2 doses. So I think that's going in the right direction. But I think what's really important is that when we talk about schools, just as Rachel was saying, I think we really need to recognize that they're not safe or unsafe. They're a spectrum. It's mostly reflects what's going on in the community. And there's many benefits to children and youth being in school. And I think there's a lot of risks that they're exposed to by not being in school. And in many cases, those risks are more severe than the risk of COVID itself. So I think we need to really think about those things when we're making these types of decisions.
All right. Well, Dr. Smart and Rachel Gilmore, thanks so much for joining me. And it's been great chatting with you both.
Thanks, Wyatt. Appreciate the invitation. Have a great night.
Thank you.
Yeah, thank you so much, Wyatt.